oh, I want to conceive, I'm trying, it's not happening.
Oh, okay.
Or they're working with, oh, I'm getting increased facial hair, mustache, beard, everything. Or increased acne, usually in the face, upper chest, upper back. Or getting increased body mass, as in getting obese or getting overweight. Yeah. So those are the main ones.
I'm very concerned about the facial hair, the increased facial hair. So has there been any form of research to like link why is it the hormones? Why the facial hair?
Yes, so they tend to have, the ovaries tend to produce slightly increased or more than usual levels of the male hormone, the testosterone, in them. And then once testosterone levels are higher than the average woman, you tend to have all cells that have, or all hair, all areas that have hair that are responsive to these, particularly the facial one. Men have high testosterone, so we have hair, facial hair. But then once you have beyond a certain limit, you like to have these hair in these areas respond as well. So yes, it's from a result of the heavy or the increased testosterone levels.
I see. With the beards and even on the chest and all that. And I see that would be quite embarrassing.
Yes, it has a lot of psychological effects on the patients as well. So yes, ultimately, if it's severe and prolonged, some can get into anxiety and some depression over time. Because of the.
Okay, so I guess because of the male hormones they produce, that will still be a contributing factor to the infertility, being that they are kind of, less, in quote, less of a woman or something like that, and they are, I don't know, maybe I'm not getting it right.
Well, what happens is that the primary cause for their infertility is that they do not ovulate on a regular basis.
Okay.
So typically, in the women who are not affected, every month at least an egg is selected. That process is not very consistent in them.
Okay.
So there are months that they ovulate, there are months that they don't ovulate. If they don't ovulate, they are going to go off their cycle for a couple of months. Along the way, they will ovulate and they will flow.
I see.
So that is the primary responsible factor for they not having or achieving pregnancy.
Yeah, pregnancy.
The androgen levels, yes, it's also